Hi everybody, welcome back to Recovery Road. We appreciate your willingness to share some time with us and watch our videos on our YouTube channel. I'm Meghan Fawcett. I'm the Vice President of Clinical Treatment with Meridian HealthCare.
And I'm Julie Lenyk. I'm Director of Recovery Support Services with Meridian HealthCare.
We've received some questions, some inquiries about family and family members' roles of somebody who is in treatment. We cannot ignore the fact that every single person that walks through our door has a family, has support members, people in their lives that are concerned about them. And one of the most important questions we're often asked is, how can a loved one, a support member, or a family member get involved in the treatment of an individual? And right from the beginning, at the time of assessment, we welcome every single person who is being seen for services to sign a release of information for somebody, someone that can help support them in their treatment and their care, because we do offer programming to family members that have a loved one in treatment.
Yeah, I mean, the reality is that the family members or primary supports are the people that are, typically closest to the individual who's seeking treatment. So you individuals can be really, really beneficial in the treatment and recovery process. And we try and are open to engaging family members and supports from the beginning. Whether you're just offering to help the individual who's seeking treatment to make the first phone call, or taking them to treatment for the first time, even that initial assessment process. Being willing to sit with them through the assessment process, being willing to drive them to meetings as they're starting to establish their recovery supports can be really important.
It can feel very helpless. If you're the loved one of somebody who is experiencing addiction, you see the pain that they're in, you see the pain that that individual may be causing other people, and you have needs too. So it's important as a loved one of somebody who's trying to, work a recovery program, that if you have needs, that you reach out and get some help too. There are support groups in the community, there are support groups at Meridian, and we offer services such as one-on-one individual counseling to individuals who have a loved one in treatment. It is completely okay to feel lost in this process, to think that, maybe as your loved one's getting better, that, maybe you're better off not being a part of their life because you now see that they're making these changes. We all have work to do. So we welcome a loved one into our services, into community services, to come in and get a consultation and ask, what can I do to support my loved one? We're here for you too.
It's important to, when those things like education groups are offered or individual counseling is offered, it can be really helpful for you to get an understanding of the disease of addiction, how it's impacted your life, the life of your loved one, but also to get some support and counseling in regards to what you can do to better yourself, because you've been impacted by this disease as well.
All of our counselors in each of the programs that we've talked about in previous videos are trained in providing family supports. So say you have a loved one that's in services and your loved one says, I want you to come into one of my sessions. We don't often have family members come into treatment groups with other clients, but we do have family group support services that are offered, and we will, as one-on-one counselors and case managers, ask for family members to come in and be a part of that treatment too. So say your loved one comes home and says, my counselor wants you to come in for a family session. It doesn't mean you're in trouble. It means that we're ready and willing to work together because, maybe your loved one is ready for that level of care and that step in treatment. It's important. We want you there.
And I think it's important to note too that there are community resources out there for you. You may have heard of things like, 12-step support groups for family members, like Al-Anon,
Families Anonymous,
or Nar-Anon. And those are free services that are open to the public and are available for you.
Absolutely. There are individuals that are experiencing many of the same things that you are, help you feel that you're not alone, and they're working a program trying to reestablish themselves as a family member of somebody who's maybe not quite ready for treatment or is actively involved in a recovery program. You'll find folks there that come from all walks of life who are in all different stages of their own recovery, and you'll find someone that you can connect with.
They're here and willing to help.
So we would be remiss if we didn't address the issue of family and know the needs of family members of someone who's working a treatment program or an early recovery. We want to be able to be here and help you. So as you continue on, we're here for you too. So if you have questions, be sure to submit them to Julie and Megan at Recovery Road through our contact page on Meridian's website. Please continue to watch our videos on meridianhealthcare.net.
And remember, if you're thinking about treatment or recovery, or you are in recovery, or you're a family member or friend of someone who's considering treatment and recovery, please keep going down Recovery Road. You'll like what it looks like when you get there.